afternoon for our TA call. The recording is in progress, as you probably just heard, but we have a jam-packed agenda today, and I'm just going to run through that real quickly before we start with the main event. In a minute, I will be covering some updates, but then I'll be turning it over to Christine Pilgrim, our Associate Division Director, who will be discussing the indicator B17 and C11 guidance. Many of you probably recognize that as the State Systemic Improvement Plan, which is due on February 1st this year. After Christine is finished, Brenda Wilkins will be reviewing the Part C Child Find guidance and sharing some TA resources with a spotlight on the long-awaited Part B 619 Child Find self-assessment. After Brenda, we will move to Jennifer Barrett-Zitkus, who we affectionately call JBZ, and Janet Guerrera, one of our newer staff, and they will be reviewing the Part C IFSP guidance and TA resources, which will include C2B transition, something very important to Part C, but also to Part B as well. After that, Keisha Blythe will share the recently released Supporting Child and Student Social, Emotional, Behavioral, and Mental Health documents, along with other TA resources. We'll take questions at the end, but we'll follow the chat and the Q&A. If you have any state-specific questions, we suggest that you follow up with your state lead rather than asking those on this call. One last thing that I want to mention is that the SPP, the 2019 SPP APR indicator analysis documents are live. They're posted on the IDEA website under our SPP APR resources tab for both Part B and Part C, and those will be appearing right above last year's documents. So I wanted to make you aware of that. That just happened, and I'm sure that many of you will want to visit that link. So my only announcements here are a couple updates. There are two TA webinars on the APR reporting tool. The first one will be next Tuesday, December 14th at 2 o'clock. And it will be on the SPP APR Part C technical webinar. There will be a kind of companion webinar the following day, the 15th of December at 2 o'clock on the Part B, the Part B platform. Then following that on Thursday, the 16th at 4 p.m., we will have our final DMS webinar for 2021. That's 1 week earlier than we typically hold it each month, and that's due to the holidays. We've changed our schedule a little bit. And then moving into 2022, on January 13th, we will have a webinar on the grant application process for your FFY 2022 Part B and Part C applications. So I think that's it. And I am ready to turn it over to Christine.
Thanks, Greg. Swati, you can go to the next slide, please. So as Greg mentioned, I am not the star of the show. You guys are waited with bated breath for the roadmap guidance that my colleagues are going to talk about shortly. I'm just going to spend a few minutes talking about some reminders specific to C11 and B17, because we've been getting a few questions coming in from states about expectations. So just want to reiterate a few things. You know that all of you are working diligently on your SPP APR submissions using the templates that are posted. I know because questions are coming in, or as you find typos or errors, you let us know. But your OSEP is due on February 1 with all of the indicators. As you know, you will be reporting on that indicator within the EMATS reporting tool. It will not be a separate submission as it has been in past years. And as we've expressed and I've shared with you in previous calls, to move into compliance with the Evidence Act, the department needs all of the data coming into the department to be in a machine readable format within one system. So that is what we're moving to. So moving away from attachments, everything is in the tool. I know that doesn't make you tremendously happy because there are certain rich text restrictions, but you know, we're all in this together and are looking forward to your submissions in the tools. So on February 1, when it comes to C11 and B17, you have to report FFY 2020 data, and you have to set targets for FFY 20 through 2025 as required by the measurement table. And as was the case with the previous phase 3 reporting requirements, all states must report on the 4 specific content components. So the data analysis, the implementation analysis and evaluation, stakeholder engagement, and any additional implementation activities. This is all noted in the measurement table. What's new this year in terms of us thinking about everyone reporting in the tool, our inability to have rich text and graphics and whatnot, we've asked all states to provide links to their current theory of action and their current evaluation plan. So all submissions, we were also asking you to include that information. I encourage you to review the measurement table and the reporting templates in tandem for all of the specific fields that are in the reporting platform as you plan for your submission. Next slide, please, Swati. So for states, we recognize that there are going to be some states that are completely changing their simmer, et cetera, and others that are retaining the same area of focus. So just wanted to talk through briefly what expectations are where that is concerned. So states may continue to work on the same state identified measurable result as they did in the previous SPP APR. If a state is continuing to implement the current OSEP that you laid out previously, you know, same implementation activities, et cetera, all of that, and you haven't identified a new simmer, then any information that you previously reported to us does not need to be resubmitted with your FFY20 submission. In addition, I want to remind you that if you intend to continue implementing the OSEP without modifications, that you must describe how the data from the evaluation support that decision, and that's included in the measurement table. That's a requirement that's in the measurement table and has been there. If you're making adjustments to your OSEP without changing your simmer, we would expect that you're reviewing your theory of action and your evaluation plan and modifying it as necessary. The evaluation plan should be reviewed at least annually and updated as appropriate, as it dictates the various data collection points and sources that states are using to measure progress towards the simmer. We encourage you to work with your TA providers. I know some of you have external evaluators, et cetera, to develop and utilize an evaluation plan to inform your OSEP implementation decisions. And as I mentioned earlier, you have to submit a link for your theory of action and your evaluation plan. Next slide, please, Swati. So for those who might be changing a simmer, in your submission, you're going to have to establish a new baseline in addition to setting those targets for FFY20 through 2025. As we noted in the Universal TA document, any state that changes their simmer should provide details in the February 1 submission regarding the system analysis, data analysis, and stakeholder engagement activities that were conducted to reach the decision to make that change. Additionally, states should be reporting on the infrastructure improvement activities, coherent improvement activities from previous OSEP activities that you're going to leverage to improve the new outcome area that you have chosen with that stakeholder input. And we're also looking for you to report any newly identified system components and evidence-based practices. If you're choosing to change your simmer, developing a new OSEP, once again, we're expecting that you would be submitting that link for the revised theory of action, as well as the revised evaluation plan, consistent with the requirements in the measurement table. Although states are encouraged to communicate and engage with their state leads and TA providers around work to change the simmer, you're not required to get pre-approval from OSEP in order to make that change. If OSEP has any questions or concerns about a state's new or revised simmer, that will be documented in our response to you in OSEP response, and we can discuss it during the clarification period. Next slide, Swati. This is just a slide with resources. There's a plethora out there. Greg also mentioned, I'll give an additional plug for the FFY19 indicator analyses that were just posted. The quick link we have for the SPP APR resources for grantees will include that information as well, but you have links to the measurement table, the instructions, the reporting templates, as well as incredible resources that have been put out by our centers that could help support you in this work. And I am going to turn it over to Brenda.
Thank you, Christine. That was very calming. That was a very calming presentation. I appreciate it.
Brenda, I don't think I've ever been ever been told that I was calming, but thank you for that. I hope that everyone else got that too.
All right, everyone. Thank you for joining us today. Today, we're going to go over the Part C guidance that we recently issued in, I believe that was October 28th. It was late October, in late October. I'm not going to go into detail because I really want to highlight the resources that are available as far as child find that states can utilize as you start to revitalize or look at your child find efforts in more detail. So as far as the Part C guidance, it addresses the responsibility of lead agencies and EIS providers if a referral was received, but the family was not contacted due to the pandemic. It is important for states to reach out back to those parents if the child hasn't aged out. If they have, try to align them with Part B, child find efforts. The second question is, if a parent declined consent to an evaluation or consent to Part C services, it really is not the responsibility of the Part C, but it's important for, if a parent declines, but it's important for the Part C to maybe reach out to see if the family was aligned with Part B. The third is the parent provided consent to an evaluation, but the evaluation was not conducted, and if the lead agency or the EIS program can conduct virtual screenings and evaluations. When it comes to the virtual screenings, yes, you can, but you just want to make sure that those tools that you utilize are valid, reliable, and that are made to screen children and provide evaluation to children virtually. Next is the Part C child find self-assessment. Within the guidance, within the first couple of paragraphs, we really strongly suggested that states utilize the child find self-assessment as you look at your child find efforts and try to strengthen your child find efforts. So next slide, please, Swati. So I just want to talk a little bit about the tool. I'm sure most states have used this or have looked at the tool, but it's a very comprehensive tool that is designed to strengthen your Part C system. It's divided into four sections, and it has 7 best practice themes or areas that states can utilize. So those 4 sections are: 1, the statutory or regulatory requirements, which is everything that a state agency needs to have an effective child find system. The second section is the best practice. The third are technical assistance resources. And then the fourth one is OSEP policy letters and guidance. Next slide, please. Thank you. So I want to highlight the 619 Child Find Self-Assessment. We have not published it yet, but I want to give you some general feedback on the general information on the self-assessment. It is created to support programs in establishing an efficient and effective child find system. So it's very similar format to the Part C self-assessment, and we're gearing it more towards local education agencies and, of course, district level focus, because most child find efforts are within the district. So the components are pretty much the same. It's the regulatory component, there's a best practice, there is a technical assistance and resource section, and there's also OSEP policy letters and guidance as it pertains to 619 in preschool. As far as the best practice themes, they include, but they're not limited to, these themes that you see on the screen, to cross-sector collaboration, data systems, technical adequacy, and screening. So it looks very similar to the Part C self-assessment. It looks similar to the funnel tool that Daisy issued a few years ago. We just want to make sure that states are familiar with the format, so we're not reinventing the wheel, and we're making sure that states are aware and can utilize this tool without a big, change in learning curve. So next slide, please. So we are in the piloting process of piloting the states. We started in November. So we have 3 states that we are piloting. It is Virginia, we have Florida, and we have Connecticut. So they are all in the piloting process, and we're looking forward to getting their feedback so we can issue the CFSA to you as a whole. Next slide, please. So I want to talk to you a little bit more about the different resources that are out there. First is the Meaningful Difference tool that you see. This is an Excel-based calculator that allows states to make several comparisons related to the percentage of infants and toddlers compared to with their state targets. So it's a very informative tool that states can use as you move forward and looking at your child find system. Next slide, please. So we also want to highlight the child find funnel tool. And this is a chart that kind of highlights the tool, but the tool is really important because it is also an Excel template that displays data on each step of the Part C process, from referral through exit. For a set of infant and toddlers that were referred to a specific to a program during a specific time frame. So the data can be entered within the for the entire state. It could be entered for a local program, or maybe one or more of a state subgroups. So the tool really enables Part C program administrators to easily visualize the differences in the number of children in each step of the process. So it's a very good tool to utilize. Next slide, please. So here are the resources highlighted. I do want to highlight the Part C Child Find Self-Assessment has a self-assessment quick start guide that ECTA and Daisy developed a couple of years ago. It's very easy to utilize, and it kind of helps you look at the different best practices and kind of highlight where you can highlight what specific area or best practice bucket that you would like to focus on. And then of course, this is all hyperlinked in there. There's a Part C Child Find Funnel tool, and of course the Meaningful Differences Child Find Calculator. So now I would like to change it to my colleague, JBZ. JBZ, over to you.
Thank you so much, Brenda. Really excited about the preschool 619 Child Find Assessment and Pilot. So I'm today going to be sharing at a high level the guidance that was released specific to the Individual Family Service Plan, or the IFSP. So this focused on the development and implementation of the IFSP, and it builds on the previous guidance that we gave regarding the interim IFSP. Everything is in full effect for all children, including those with an interim IFSP. We also acknowledged how the impact of the pandemic has taken its toll on children and families across the nation. And the IFSP team is uniquely aligned to consider how the family's capacity to support the needs of children and their families through the IFSP document. We know that there's been a great deal of concern, and we recognize that states will continue to address that, and it's important to do that through the IFSP, along with ongoing assessment that is most appropriate, as well as individualized for each child. We want to recognize that it is the IFSP team, which always includes the family, that makes decisions about what the unique needs are of both the child and family and their situation, and decide what's most appropriate in terms of individual family service plan services and delivery methods and frequencies. I do have some resources that my colleague Jeanette is going to share after she talks a little bit more about compensatory services and transition services. Jeanette?
Thank you, Jennifer. Good afternoon, everyone. As JBC just said, I'm going to continue with this document, and then we'll go into some resources. So this guidance also addresses the need for the lead agency and early intervention service providers to review the data they have to identify services, whether you're talking about ongoing IFSP services or transition services, that may not have been provided, as well as updated assessment information related to the child's progress towards results or outcomes identified in the IFSP. And then through the IFSP review process, to determine whether and to what extent compensatory services might be needed to address service disruptions related to due to the COVID pandemic. These decisions are, of course, all individualized and based on updated assessment information for the child and the family. In regards specifically to transition services, state lead agencies and early intervention service providers are strongly encouraged to work closely, not only with your Part B counterparts to fulfill those required transition activities for children who are eligible for Part B, but also with community early childhood programs for those who are not eligible for Part B and may be transitioning to other programs. Smooth transitions take extraordinary collaboration under normal circumstances, and so we expect that it will continue to take extra efforts and cooperation during these remarkable times as programs are returning to in-person services at varying stages and have different policies that will influence those practices. That being said, we also want to urge states to take this time as an opportunity to look systemically at your transition process and procedures, and to maybe identify strategies to build infrastructure that supports a seamless system of service delivery. So that might include developing or revising MOUs or MOAs or interagency agreements, looking at your Part C eligibility and possibly considering serving infants or toddlers at risk if you don't already do so, possibly exploring the extended IFSP option, and building workforce capacity in infant and early childhood mental health, to name just a few considerations. It certainly includes considering how supplementary funds, such as those from the American Recovery Plan Act or ESSER and or GEAR, might be utilized. Finally, it reminds states of the obligation to report any non-compliance data in their SPP APR. And we do want to mention that the document references some health and safety related resources from the CDC, but we'd also like to take some time today to share a few other resources with you specific to the implementation of IFSP ongoing and transition services. Next slide, please. The first document, Telepractice for Part C Early Intervention Services, was very recently released and compiled by ECTA and DACY in collaboration with the Infant Toddler Coordinators Association. At the beginning of the pandemic, as you know, states turned to remote service delivery out of necessity. And this document can support states' continued exploration of the use of telepractice as a method for improving equitable access to high quality early intervention services and in securing Medicaid coverage for telepractice beyond the public health emergency of the COVID pandemic. The second resource is a training package that was developed collaboratively with staff from the ECTA Center again and the Western Regional Resource Center in response to need expressed from state and local providers to have specific information and resources about developing high quality functional IFSP outcomes and IEP goals. And it's not new, it's been out there for a while, but worth reminding everyone of. Next slide, please. These resources are also not new, but remain quite relevant. The first one addresses reviewing existing documentation and can be used as a checklist during transition planning to gather key Part C information for consideration during the Part B evaluation and eligibility determination process. We know that families and Part C programs have a wealth of information to share during a transition planning conference, and it's vital to gather all available information to establish eligibility and develop a high quality IEP as timely as possible. The challenges we've experienced during the pandemic have certainly required programs and providers to be innovative in seeking information and obtaining documentation. So again, as you look at your transition policies and practices, this might be a useful tool to identify ways to decrease duplicative efforts that make way for more timely and smoother transitions. The next one, late referrals to IDEA Part C. This is a chart and it illustrates the Part C and Part B requirements and timelines and the roles and responsibilities in each of those programs within 3 referral time periods. So for children referred less than 45 days, those that are referred and determined eligible between 46 and 90 days, and those that are determined eligible between 91 and 135 days. So lots of details in this useful chart. And then the third one, the early childhood transition timeline for SPP APR indicators C8, A, B, and C, and B11 and 12 is a flow chart, and it illustrates the required steps and timelines for Part C children determined eligible at least 90 days prior to their 3rd birthday. So all about the compliance there. Next slide, please. And then finally, we want to remind you of resources related to the DEC recommended practices of transition. The first one is an online module developed by the Early Childhood Recommended Practices Modules Project that takes participants through the Plan, Do, Study, Act cycle to learn about, implement, and make improvements to their transition practices. And then, of course, the practice improvement tools specific to transition on the ECTA website. It includes all of the tools that are available for each of the DEC recommended practices to build capacity of practitioners as well as families. And so those include checklists, illustrations, which may be a combination of videos and or written descriptions, and then the 2 sets of practice guides, one for practitioners and one for families. As always, we highly encourage your use of the many tools developed and available through our fabulous TA centers, as well as engaging in conversations with your TA center state liaison and your OSEP state lead to support implementation of recommended practices within your IDEA programs. So with that, I'm going to pass this on to my colleague, Keisha Blythe, to talk about early childhood social and emotional wellness.
Thank you, Jeanette. Researchers suggest that children's experiences, even in the earliest stages, affect their social, emotional, and behavioral development. Therefore, supporting students' social, emotional, and behavioral development at early ages may mitigate the need for long-term services and supports. The Department of Education Technical Assistance Centers offers high-quality and free resources related to integrating and implementing social, emotional, mental health supports within early childhood programs, supporting social emotional competencies and overall wellness in programs, trauma-informed practice, and ensuring equity. In the Supporting Child and Student Social, Emotional, and Behavioral Mental Health document, it provides comprehensive information and resources to enhance the promotion of mental health, social, emotional, and behavioral well-being of young children. This guide acknowledges the challenges inherent in scaling up mental health services and supports in early childhood settings and provides key recommendations to improve these supports and directly address this critical current societal need based on advances in research on the implementation of evidence-based practices. Next slide, please. Just to highlight a few resources for state and practice implementation, the National Center for Pyramid Model Innovations, which assists states and programs in their implementation of sustainable systems for the implementation of the pyramid model for supporting social emotional competence in infants and young children within early intervention and early education programs, with a focus on promoting the social, emotional, and behavioral outcomes of young children birth to 5, reducing the use of inappropriate discipline practices, promoting family engagement, using data for decision-making, integrating early childhood and infant mental health consultation, and fostering inclusion. The webinar for state leaders by state leaders, implementing, scaling, and sustaining the pyramid model statewide with fidelity, uses the evidence-based pyramid model framework as an approach to build social and emotional competence in early care and education programs. The webinar includes lessons learned and resources related to specific aspects of statewide implementation of the pyramid model. In the Pyramid Model and Trauma-Informed Care Guide, it helps early childhood professionals understand how the pyramid model and trauma-informed care can meet the diverse needs of young children and their families who have experienced trauma. The Early Childhood Program-wide PBS Benchmarks of Quality Cultural Responsiveness Companion is a resource for coaches and teams implementing the pyramid model to improve the fit of their pyramid system with the needs of every child and family. Similarly, the Pyramid Model Equity Coaching Guide provides a reflection tool to examine the implementation of pyramid model practices through the lenses of culturally responsive practices and identification of implicit bias. Lastly, the Behavior Incident Report System Overview Fact Sheet collects and analyzes data on elements related to behavior incidents that are used to make decisions about providing supports to teachers and children within the early childhood program. Next slide. I'm going to now turn it back over to Jennifer.
Thank you so much, Keisha. So many great resources. Thank you to my colleagues and thank you for your attention. We do want to open it up if there are any questions. Christine is still available, as well as Angela Tanner-Dean, as well as my colleagues. Brenda did have to jump off, but I think we can cover for her. I don't see any questions yet, but Swati, do you have any? And we'll, if you raise your hand or put a question in the Q&A.
I don't see any hands raised yet. So just remember that you have the option to either put your question in the Q&A, type it out there, or raise your hand and I'll let you unmute so you can say it in person.
That's great. While we're waiting for the next question, we can put up the next slide for reminders. Greg and Christine have mentioned all of these, but wanted to leave you with those reminders. We've given you a lot of information to think about, a lot of wonderful resources, some that you're already familiar with, hopefully some that you'll go back to and use. And I don't think there's anything better than a gift of time. So I will continue to pause to see if there are any other questions. Swati, are we good?
Yep, we're still good. I haven't seen any come in.
Okay, well, let's go to the last slide. Well, on behalf of the department, I'd like to wish you happy holidays. Whatever you celebrate, may it be with family and friends that you love and that you stay healthy. Thank you so much for all that you do for infants, toddlers, young children and students and their families. This has been a very difficult time and it's we recognize that, but we also know that you guys have been working extra hard. So please enjoy the little bit of time left you have. If you have any specific questions, reach out to your state lead. Thank you so much for all that you do and happy holidays.